Hello. Just wanted to check in with you for a few minutes and remind everybody of the topics we were supposed to cover this lesson. I wanted to start small this week, just with a few items, to give everybody a chance to get their feet wet and to acknowledge that some folks are still waiting for books and trying to learn Moodle and all the challenges of a beginning of a new semester. So, we wanted to try to start thinking about the question of what is prevention, what is substance abuse prevention, and what is prevention in terms of the human services field. The field of prevention is all about trying to reduce or even intervene on personal problems at the personal level or societal problems. The intent of prevention and most prevention experts would certainly acknowledge that we can't prevent every instance of drunk driving or every instance of prescription drug misuse and abuse, but we can reduce the occurrences of these items. So maybe the first thing we can learn together is when we talk about prevention, it isn't to eliminate these problems. Eliminating a problem in society isn't realistic. Sometimes reducing a problem or the number of problems that exist within a society isn't necessarily realistic either, but sometimes it is. And learning what is realistic, what isn't realistic, what types of community problems we can address effectively and cannot address, what types of prevention activities would be worthwhile for certain populations, those are all things that's related to the field of prevention. As secondarily, prevention is based on science, on research. I think in the notes I mentioned, if you remember your scientific method in your middle school biology science classes, prevention is based on many of the same concepts. Whatever we do in the prevention field, in the human services field, has to be based on some type of evidence that the action is actually going to work. Times have changed in terms of human services in general. When I first entered the field, it was more acceptable just to say, yes, if it feels good, if that's how we would want to treat the client, then that must make it an appropriate service delivery method. But these days, especially during times of tight economic times, reduced budgets, greater oversight, we must be able to prove that what we do actually works. And that's the interesting thing about prevention. There's a lot of research out there that says, when properly implemented and structured and evaluated, many of our prevention activities can make significant impacts on families, on individuals, on societies, and reduce the cost of social problems in our communities. But at the same time, there's so many prevention activities that have not been properly implemented or properly researched that's really failed significantly, that we hear about on the news, and that just gives us a reason to doubt prevention or any other human service activity. So we must learn together what works, what doesn't work, why it works, and why it doesn't work. And we'll start talking about those issues in the next couple of weeks. Again, I wanted to start slow this lesson week, and hope everybody has a good first week of the semester. Thanks.